Let me get started. My name is Susan Downs, and co-hosting is Stephen Fox, a genius. And this is Silicon Valley Health. Don't laugh, we know you're a genius. And this is Silicon Valley Health Institute, where our goal is to get information out to the public, because sometimes information is hard to find. And so we put all of our Zoom meetings online on our website, www.sbhi.com, which I put in the chat box. We're a nonprofit organization. And we were having weekly Zoom meetings. We've had people like Thomas Levy, and we've got some British greats and all sorts of people. So this week we have
now Pam.
Huh?
Yeah. And now Pam.
Thank you.
Yeah. So anyway, I came across Pamela in one of her videos. I was very impressed. So anyway, she's the president of the Wellness Forum Health group. She's the founder of this group, and the company offers educational programs to both consumers and providers that help with decision making. And it deals with diet, lifestyle interventions with long-term health outcomes improved. Through its network of providers, it's direct-to-consumer healthcare services. She serves on the Physician Steering Committee and is the president of the board for the Physicians Committee for Responsible Medicine in Washington, D.C. She is one of the healthcare professionals involved in the famed Sacramento Food Bank Project, which economically disadvantaged people were shown how to reverse their disease and eliminate medications with their diet. She's been featured widely through documentaries, include Processed People, Making a Killing, and Forks Over Knives, which played in major theaters throughout North America in 2011. She's one of the co-authors of the companion book, which is on the New York Times bestseller for 66 weeks. She's the author of Food Over Medicine, The Conversation That Can Save Your Life, and her most recent films are Food Choices and Diet Fiction, and she co-authored many other books, including companion books. She's straight talking, and we look forward to that now. And we will be asking her questions because what I've seen is great. So welcome, Pam.
Thank you for having me.
Yeah, so anybody who is participating is free to ask questions, and please use the chat window. And if you would like, if you'd like to be called on to ask the question personally, please raise your hand. Click on the raise hand feature. That'll bring you up to the top of the screen where we can actually see you as hosts. We can see you asking to be called upon.
But in the meantime, I've got some questions.
Fire away.
You've posted a lot on this COVID thing. And so what are your opinions of the COVID virus, mask, how we keep healthy? Do we just keep our immunity healthy? Or what? I mean, I know you've got some opinions on it. So how about sharing them?
Okay, well, I'll just give some background and context for this. So as you mentioned, my business is informed medical decision making. And for 25 years, we've been looking at everything medical, including diet and lifestyle, but everything medical, and helping people understand the risks and benefits of doing various things. And so when something new comes out, whether it's a new drug, a new procedure, a new dietary protocol, I mean, whatever, new, we would look into it. All right. So when this thing first surfaced at the end of February, beginning of March, it's something new. So that's why I started looking into it. And it was eerily reminiscent, some of the early things that I saw, of a pandemic that was declared back in 2009 and 10. It was a fake pandemic. The World Health Organization and the Centers for Disease Control, it's kind of a long story, but if you look into it, there's information on my website about it. There was a fake pandemic back in 2009 and 10. And here in the United States, as usual, nobody loses their job over these kinds of things, because you can be a career criminal and keep your job with the government. I'm just tired of trying to be nice about all this now, But in Europe, there was a little bit of embarrassment. Nobody lost their job. I mean, don't misunderstand, everybody kept their job, but there was at least a little bit of embarrassment about the whole thing. And so here we are again, it sounded kind of like that. So I put out this video and I said, I really think that this is a situation that's China's kind of trying to drum up some distraction from some of the mischief that they're getting into. Not very happy with the United States now. I think that's what this is. And of course, it turned into a whole lot more than that, but that's how I got started with this. And then the more I started digging, the more I realized that there's really a very, very dark agenda here. There's no pandemic. It isn't even as virulent as the seasonal flu. It's certainly not as lethal, but this has just been all invented. So, you know, people have, a lot of people have called me to task and said, gosh, Pam, why aren't you telling people how to improve their immune system, and they ought to eat more vegetables and drink more water? And my answer is always the same thing. If I thought that eating more vegetables would make Dr. Fauci tell the truth, my gosh, I'd eat broccoli from the minute I get up in the morning until I go to bed at night. If I thought that drinking more water and getting more sunshine would make some of these people become honest about all of this, then I'd really be on board. But I think the key is, I've always been about promoting health. Take care of yourself. But that's not what's going on here. What's going on here is that we have a few bad actors who have taken over the world. And I'm not kidding. If you haven't noticed, what's going on here is going on in every other country. They've taken over the world. They've locked down the world. And if we don't start to get active and organized and take our countries, plural, back, we are going to live under this type of tyranny for a very long time. And it has morphed into, it started out, it looked like it was going to be a fake pandemic like 2009 and 10. And now where it's morphed into, and I know these are strong statements to make, but I can back them up, is this is just like Nazi Germany. This is just what the Germans were doing. All this contact tracing, there are only 2 times in history when we've seen this type of government data gathered on citizens. Stalin did it and Hitler did it. And we can talk about how they did it, and then we all know what they did about it, right? So this kind of thing terrifies me. Right now, you have to either wear a mask to get into the store, or you have to have papers showing you don't have to wear a mask. How long is it going to be before they put an armband on me, right? Got to have some kind of papers to walk. I even tell them, you know, it's interesting. It is just like Nazi Germany. Here I am with my papers explaining why I don't have to wear a mask. So maybe next time I come in, and you're going to want to have an armband on me too. So our rights have been taken away at an unprecedented rate. And it's very frightening time. And right now, focusing on your immunity is a good idea always to do, but focusing on getting our rights back is the thing we have to do right now.
We have a question in the box about, can you give an overview of what you launched today?
Yeah, so for a long time, I've been involved in legislative efforts on a number of different fronts. I've been successful at some of it, different conversation for a different show. But anyway, in recent years, particularly, I've been involved in parental rights issues and that sort of thing. And we have so many people out there who have worked so hard on trying to get rid of the vaccine mandates, prevent them from happening. And so here's what goes on, all right? And then I'll get to what we're doing today. So if you're trying to get in front of a legislative body and try to keep a vaccine mandate from getting passed, you put up an expert, they put up an expert. You put up 5, they put up 5. You bring in consumers, they bring in consumers. You provide articles, they provide articles. And at the end of the day, nothing happens. It's all a wash. And legislators say, well, we have to do some more research, and I'll have put on my team look into this. And there's always a reason to kick the can down the road, right? And in the meantime, you've got several states now where you can't put your kids in school unless they get jabbed 57 times before second grade or kindergarten rather. And we know what the end game is here. Part of the end game is that Mr. Gates, he said it publicly, he wants 7 billion people to get a vaccine with a tattoo, with an immunity passport, so that cops can walk around with smartphones and know that you're okay and approved to be outside. It is just like Nazi Germany. That's what they want to do with it, 7 billion people. Drug companies get rich. People like me who are high risk get dead, and everybody lives happily ever after in Bill Gates's world. So if we're going to keep this from happening, we have to take action. So I've started a group called Make Americans Free Again. Make Americans, plural, freeagain.com is the website. And we are going to assemble the largest voting bloc in the history of the United States, centered around one issue. And it's very, very important that it be very, very simple and a yes or no question. I want the right to accept or refuse any vaccination based on my choice, and by extension, my minor children. I want control over that too. And if you're a yes, you join us. If you're a no, you don't. And when you get in front of a legislator, it's very simple. It's a yes or no question. And if you refuse to answer the question, I will assume you're a no. Now, we've tried reasoning with these people. As you can see from what's going on, nobody's interested in any science. This has nothing to do with science. This is just pure brute power. We've been taken over by despots and criminals who are running our lives right now. And the only way we're going to get rid of them is to sit down and have a conversation like this. And I've done this with all the legislative districts in Ohio. Most of these people win their elections by 2,300 votes, 1,600 votes. And so you sit down with your ginormous voting group and say, you know what? We've done some research on you. And in the last election, you won your election by 1,811 votes. Well, we have 7,000 people in your district. And if you do not start voting the way we want you to vote, you're out of here. Now, they won't believe you because they've never had to deal with this before. But I'll tell you what, in a state like Ohio, you take out 4 or 5 people and they start to get very nervous because you know what? The thing they want more than anything else is to be in office. That's all they care about. They don't care about you. They don't care about me. They care about drug money because that's where they get a lot of it. They care about special interest money. That's how they get the money to run for office. But those people can't vote for them. You and I can. And I'm very, very positive that if we start doing this state by state assembly, and what we're saying to people is, look, don't stop belonging to the groups that you belong to. Stay with those groups, but let's aggregate all the groups. Let's get 75 million people together, and then we can really get something done. We can start to make a huge impact locally in our states and nationally. We will choose the next president of the United States if we have that kind of a voting bloc. And it gets me excited because I think we've got to go from feeling helpless, which everybody feels right now. Everybody's putting more and more and more rules on the table every single day for absolutely no reason at all. It's just like Nazi Germany, and we have got to take our power back. So it's makeamericansfreeagain.com. You register there, and you join our group. And one of the things we did, by the way, if you live in the United States and you're watching this, we have assembled an enormous resource center for people who are homeschooling their children. We have people who do one-on-one assistance to help you do this. We have conference calls that will help with this. And we even have a group that's agreed to give a $50 certificate to anybody who wants, for resources, to any family that wants to homeschool. The one-time gift to help us help others. So we got to get these kids out of these despotic places they now call school. We don't send them there. They'll be psychologically damaged for life. So that's just the beginning of us providing resources to people to address all of this nonsense too.
How are you able to not wear a mask? And how can other people follow your example?
Well, right now it's getting a little bit more difficult. I've tried to get arrested, and because that would kind of be fun for everybody to see. But they're not arresting anybody. It's just a civil fine. The biggest problem is just stores that don't want to deal with it, that don't want to let you in. So, we write letters to people, to stores, and say, we'll come back after the mask mandate's done. And I think that has to be bigger numbers. All right. So let me give you an example. Whole Foods is really drawing the line. They're not letting anybody in. Well, when I say I'm not coming in, they don't care. If 20 million people write to Whole Foods and say, we're not coming in until you take that off the table, they do care about 20 million people, right? So I think that the mask mandates will be, we have to put pressure on people who put pressure on people who put pressure on people. That's one of the things that has to happen here. So, for example, going back to the school situation with the masks in the schools and all this crap that they want to do, 40% of parents say they don't want to send their kids to school. Well, if we actually get them to withdraw their kids, the school systems get paid based on a per head fee, partly. That's where part of their money comes from. You can disable the school systems by withdrawing so many kids the buildings can't open. And then the teachers don't have jobs, and the teachers start pressuring the politicians. And so we have to put pressure on systems to put pressure on systems to put pressure on systems and people. So anyway, it's getting more and more difficult to avoid the mask situation, but I think even that could be helped by getting, like, if everybody in Worthington where I lived, if you had like 3,000 people who just went and stood in downtown Worthington and not wore a mask, what are they going to do? They don't have camps built yet. Okay, so they would, that's my cat. Hello, Shrez. He feels very strongly about this. He listens to this all the time. Freedom for the animals too, right? So he does not have to wear a mask, just so you know. But anyway, that's the best way to deal with this, and lawsuits. That's the other thing. We've got to find more and more attorneys who are willing to take these cases on. So our next center on our website is going to be pooling all of the lawsuits that have been filed all over the United States, so that somebody who wants to file a lawsuit, say in Ohio, could take the one from Florida, drop in the Ohio statutes, and file it without having to do all the original research. And so right now we've got this school resource thing done. Now we're in the lawsuit gathering thing, because I think lawsuits are the future of this. We're just going to keep them really busy with lawsuits.
How have the statistics been manipulated to make the coronavirus seem to be worse than the typical flu season deaths that would occur?
Well, you start with a test that doesn't mean anything. The PCR test, I don't know if you saw the video of the president of Tanzania tested pawpaw fruit and the durian, and they tested fish, and I mean, all kinds of fruit was positive. I mean, so I don't know, we start quarantining fruit now. Um, there are some people who are sending test kits, the test swabs in that have never been used, and they're coming back positive. The inventor of the test, it's really not a test, it's a lab tool. Carrie Mullis said it should never be used for diagnostics. And there was an episode at Dartmouth University Medical Center in 2006 where they thought they were having a whooping cough outbreak, and they used these tests, and it was 100% inaccurate. And there were thousands of tests, 100% inaccurate. So you start with a test that's inaccurate, and you basically claim that the positives and the inaccurate test are all cases. And then you get people all concerned about cases. So think about it this way. Can you imagine how funny it would be if starting in January, every day you got on and you watch the newscasters go, 11 people in Franklin County reported having a cold today. Shut everything down. Stay home, wear a mask. We're shutting the world down. 11 people got a cold. Well, that's the equivalent of what's going on. Having a case just means you tested positive using a fake test. And it doesn't mean you're sick. It doesn't mean that you're contagious. It doesn't mean anything at all. And then the death certificates have been forged. So we don't really know how many people had this, if there is a this, and we don't know how many people died. And so the goal of public health is supposed to be, one goal is supposed to be to gather data. And so they failed miserably because nobody could ever make anything out of the data sets. They're just completely fabricated from the test on up. So essentially, all it is made up stuff designed to scare people and make sure that the sheeples walk out of the house every day with their mask feeling like a person without a mask is a threat to their health.
So do you have any kind of personal speculations about the role of fear involved in people's reaction to a viral infection?
Yeah, well, in my book, which is coming out at the end of August, beginning of September, it's called COVID Operation, by the way. In my book, I talk about you had to have several things in place in order to make this happen, okay? And the first thing is you have to have a stupid population that would buy this nonsense, because anybody who looks at the real numbers, which they're counting on the fact that the people are too stupid to look at the real numbers. And I hate to use that language, but really, you know, it's 92 degrees here in Ohio, and we had 11 people that were diagnosed with COVID yesterday. And you got, I don't know how many 100,000 people walking around terrified. You got to be pretty stupid to interpret that information to cause terror, right? So the people who were behind this had to know that they had enough stupid people to carry it off. They had to know they could control the media so that, have you noticed, there's nobody like me on the news. And medical doctors who have degrees from Harvard and Stanford and are at prestigious universities, far more qualified than me, saying the same things, they're not on the news either. So the message is carefully controlled. You have stupid people, you have a message that's carefully controlled, you have very bad politicians who are stupid people and following directions, no thinking going on, public health directors who know nothing about public health. Part of public health, by the way, in addition to data gathering, is mitigation. And they're doing nothing to mitigate. Mitigate means you try to do the best you can without hurting people with collateral damage. So a good example would be needle exchange programs. In a perfect world, nobody takes drugs. In a less than perfect world, you do needle exchange. In a perfect world, nobody dies of the flu. In an imperfect world, we know older people do, you try to protect them, all right? So no mitigation going on. So the health profession had to be counted on to go along with it. And that was the perfect storm of things here. And so how did we get such a stupid population? Public education. I mean, seriously, that's exact. We have people with PhDs walking around saying that the death rate is 0.000000076 in my county. Stay home. Now think about the illogical I mean, you can't make any sense out of that data. You're talking about a person who's seriously mentally impaired who interprets that kind of data to mean stay home, right? So how did somebody like that get a PhD? I don't know. It's incomprehensible. But we have people like that right now.
We have one person asking to show the science that supports what you're saying.
Oh, I can't show that here because I've been, you know, there are 3,000 references in my book, and you can subscribe to my newsletter. And if you subscribe to the newsletter, once you do that, we'll send you, we call it the COVID collection, the newsletters with references, and then all of the transcripts of the videos that I've done, and I think there must be 50, 60 videos now, with references where appropriate. Those are posted on our members site, so you have to join to get all of that. It would take me till probably the end of the week. We would continue this if I was going to try to lay out the science here. But one thing that I've told everybody, you know, first of all, I'm all about be skeptical. So if you're hearing this for the first time and you don't believe me, good for you. That's the way it should be. All right. Now what you want to do is start looking into it for yourself. All right. You start looking at the flu data, even with their made up numbers. All right. Go to your state's health department and take a look at how many people got the flu last year, how many people got the flu this year. Go to the CDC's website. They'll tell you that every year, 1 billion people with a B get the flu. And then look at how many people have COVID, and it's like 12 million. So how is it that we had 1 billion last year, we didn't shut down the world, we have 12 million this year, we've been shut down for months, right? So you start looking into it yourself. I have never had somebody who actually looked into it with an open mind. In other words, you can't turn on the TV at 6 o'clock and say, well, so-and-so said it, so now I've looked into it. I'm not talking about that. I'm talking about doing what I did. Start dissecting health department data. Read some of the things online. The Washington State Department of Health, this is just an example, and I covered this on video clips last week. It actually said, the English translation, we're going to start telling the truth about deaths, okay? And they have a phase-in program for telling the truth. I'm not kidding, all right? There's 3 phases of truth telling. And what the truth telling is reconciling who really died of COVID and who didn't, because they have people who died of gunshot wounds that were coded as COVID. Now, I don't think you have to have a PhD in chemistry or neuropsych, you know, some type of physics to understand that if a person dies of a gunshot wound, we don't code it as a COVID death. Anybody want to disagree with me on that? You can go to the State of Washington Department of Health, and you can see the document where they basically admit they coded people who died of gunshot wounds as COVID. Now tell me how that is in the interest of public health and why you should believe anything these people say. They lie when the truth fits better. So check it out yourself. And then, and you know why you should do it? Don't believe me, you should do it so that you can be settled yourself that you know what's going on. Because if you're just believing what anybody tells you, you're probably in trouble in terms of health and a lot of other things too.
One of the things that I've been suspecting has to do with that issue of how people are coded in the system. And so my assumption would be that if people who die from other causes are being classified as COVID deaths, that you would see the COVID peak going up and you'd see all the other peaks going down compared to previous year's data. Has anybody done that analysis?
That's happening in the UK.
Well, you may see some of that, but you're not going to see enough of it to make your point. I'll tell you why. Because you don't have to gin up the numbers too much to get everybody panicked. In other words, nobody's claiming here in the United States, for example, yeah, I don't know, I stopped watching after a while. It's just painful to watch. And it's like watching nails on a chalkboard, but we're at something like 100 and some thousand deaths and everybody's panicked. If they had to, and they will do this if they have to, but if they have to get it up to 6 million, okay, then to make people stay panicked, you know, because how long can you be panicked about 112,000 and holding, right? Nobody else is dying, so how are you going to keep panic? But the point is, you have to shift numbers in a major sort of way. So they've been stealing numbers for COVID deaths in small ways that are not noticeable. So you're not going to see a huge drop in cardiovascular disease death. You're not going to see a huge drop in cancer or gunshots or whatever. In a state like Washington State, where you've had 1,000 deaths or 1,200 or whatever it is, you only have to steal to inflate your numbers by 50%. You only have to steal, you know, from each category 2 or 3, right? It's pretty crafty. These people are, they're smart, but they're stupid. And I could talk about that if you want to. Smart to have thought it up, but they're now starting to make stupid mistakes, and that's good for us. Other questions?
Well, yeah, I see two questions here that you've already answered.
Okay. I saw one, why does somebody want to be a bad player? What would motivate somebody to do this? There are a lot of things that would motivate people. Power and control. And there are people, I mean, you know, Gates is thought of by some people as quite the hero. He's the richest guy in the world. He has a history that's worth looking into. Some of you should do that, by the way. Again, don't take my word for it. Look, Google today when you get a chance some of what Gates Foundation's done in other countries, and there isn't a single health organization on the planet he doesn't support. Biggest supporter. He's the biggest contributor to the World Health Organization. He contributes to the National Health Institutes of Health, Centers for Disease Control. You can verify all this. You could spend 2 hours tonight and figure all this stuff out yourself. But when you have people like this who think that they are smarter than everybody else, I'm rich and I'm smart, and not only that, I know better. I know what's better for people. And so I'll do whatever I have to orchestrate it. And the flu vaccine in particular, let me grab Shreds so he doesn't make so much noise here. This is my buddy. The flu vaccine in particular, they have a terrible time getting people to have because it is the most dangerous vaccine. So, and every year it's a miserable failure because they never get the strain right. So in a good year, they get maybe 39% of people to take the flu vaccine. And this is with the healthcare workers being mandated and all that sort of thing. So this seems like a pretty good way to get your way with a bunch of people that just won't follow directions. That's what it really comes down to. People are just not following directions. So what you do is you turn them into subjects of your despotic regime. That's what we are right now. I mean, anybody who thinks we're living in a free country is deluding yourself. I don't live in a free country. You don't live in a free country. I can't get on a plane without having my temperature taken. I can't go any place without a mask. There are rules about everything. I have to sit 6 feet apart from somebody else at a restaurant. You think that you live in a free country with those kinds of rules? So they've made us all serfs. They're in the process of making us subjects of a communist regime or a despotic regime, just like Hitler and Stalin did. That's what and that we're living that way now, and we have enough people consenting to it that they're getting away with it, at least at this moment. So that's why they're doing it. Power and control. Power and control. People love power and control. That's what's motivated people since the beginning of time to do bad things. Power and control. So I hope you don't mind that Schroeder's joined us here, but as long as I'm holding him, he doesn't meow so loud. That's the thing, when they get older like this, they have a very loud meow. He used to not be so noisy, but anyway.
Well, I think one of the things about the good and bad classifications is that a lot of people who are doing things that I think are bad actually think that they're doing good.
Yeah, well, Hitler thought he was doing good. He was going to rid the world of inferior people. And by the way, you know who helped him do it? It's amazing. You look into this stuff. IBM. Hitler could not have pulled off what he did without a German subsidiary of IBM that had invented the punch card systems. And what they did, and this is something people need to know, is they were gathering census data. They started in Germany. They actually did it everywhere in Europe. But they gathered census data and people innocently answered their questions. It's like the contact tracing. Oh, I'm just going along. I want to protect public health. You know, okay, great. So they got all this information, and that's how they knew when they went into an apartment building, the Jewish people are in 4F. You take them out. You leave the Catholics in 4G alone. All right. And that's also, the punch card system is how they knew exactly when to have the trains arrive, because they knew exactly how much time it took to burn so many bodies in the crematorium and then get the gold out of the teeth and shave the hair and all that kind of stuff, dispose of the bones, and then you could put another 1,000 people in the crematorium, all right? So IBM actually helped them do it, and it was the census data gathering that allowed them to do it. And so, and that's already starting to happen. There's a guy in Spokane, Washington, who's in jail right now indefinitely because he refused to go along with quarantine. They're taking children away from their parents if there's a COVID positive person, because there's nothing better than social workers and churches to take care of your children for you. You all know that they're so much better at it than you would be. And having somebody who tests positive with the fake test, you got to take the kids away. That's always good. So some of this stuff is just despotic and criminal, and some of it is to keep the population destabilized while they're in the process of taking over our lives even more. And it's scary, and I know it sounds outlandish, but go read World War II history. That's my favorite part of history, first of all, because it affected me greatly, indirectly. And second of all, because I've always been fascinated with how somebody could actually do this. And everybody said never again. Well, here we are. Here we are. Same thing happening all over again. And I've actually said to people in stores, you know, I'm presenting my papers. My papers show that I'm allowed to come in here without a mask, and I don't have to tell you why. Why do I have to show you papers about anything? So the next time I come in, am I going to be wearing an armband? Maybe. I haven't ruled it out. And if I refuse to put it on, are you going to take me to a camp? Maybe. I haven't ruled it out. And you should be frightened about that too.
There are all kinds of really interesting comments that are showing up in the chat window. So when this is over, before you leave, be sure to save the chat so that you can go through those comments in your own time.
Yeah, and I'm sure some people are having trouble believing this, and I know that it's difficult to believe. First of all, nobody wants to believe something this terrible is happening. Nobody wants to believe it. I didn't want to believe it. And I said on my video that's on the Make Americans Free Again website, that you know, I naively thought back in March that this was a bad thing that would pass. It's a bad thing that's getting worse. We're worse off now than we were in March, people. Much worse off. There are every day that goes by that these businesses are closed and people are, there are people that are just never going to come back from this. And the suicides are going up, and the drug overdoses are going up, and the people who are not getting medical treatment that they should have had, they're dying. Old people in nursing homes. I mean, we have seen copies of letters from people that people are receiving saying, you know, since your mother has been without any human contact in the nursing home for the last 4 months, she's lost interest in eating. She's probably going to die pretty soon. Well, I mean, it's kind of genocide for older people now in this country, which is despicable. So when does it stop? It stops when we all say it stops. That's when it stops. And we have to get our head out of the sand, and we have to realize that there are, I call the sheep co-conspirators, because they are. They may not know that they are, but they are. I remember, and this you can hear online, this is available online. There's a video called How Do You Kill 11 Million People? And a German couple, I heard this at the Holocaust Museum when I was there, but a German couple are talking about when they were in church on Sunday and they could hear the trains going by with the Jewish people screaming. And they said, we started singing louder, so we didn't have to hear it. And so I said on one of my videos recently, so you mask-wearing little snitches hiding in your basement writing letters to the editor, sing louder, because that's what you're doing. And God help them, because they know not what they do, but what they're doing is horrific, horrific.
I basically said something to that effect when I was writing or editing the Stop the FDA book, and recognizing when I was doing volunteer work for the AIDS underground community in San Francisco that most of the people in the FDA honestly believe that they're doing me a favor by preventing me from buying vitamins.
Yeah, they do. And that's brainwashing. That's power-hungry government. They're not working for us. They are not working for us at all. The government doesn't work for us. The government doesn't care about us. Your elected officials don't care about you. They only care, and nobody's thinking. No thinking person could be doing this and implementing this and going along with this. No thinking person. And So we have a big job ahead of us, but we have to do it. I mean, you know, the last thing I need, I'm 63 years old, and life for me is actually pretty comfortable right now. The last thing I needed was this. And the reason I'm doing it, people have said, why are you putting yourself through it? Because I really feel that if I don't, I'm trying not to cry here, but if I don't, I'll look back and say, I had the resources to do it, I had the audience to do it. And if I didn't do it, I'm part of the Sing Louder group, and I don't want to be that. So that's why I'm doing it.
One comment says that this pandemic was created to cover global economic collapse. And I was earlier going to comment on the financial plight of the pharmaceutical industry, that as the number of new drug candidates has been dropping by order of magnitude each decade, and as their rapid throughput screening has stopped being able to make up for that, and that they're now migrating towards vaccine market as a captured market, to keep themselves afloat. And I think it's probably true that a lot of people in the pharmaceutical industry and in the medical industries are convinced that we need the pharmaceutical industry intrinsically.
Right. Well, you bring up another thing too, just there are a whole lot of economic influences. I mean, one of them is China has stated outright for a long time, they want to be the global dominant economy, right? Well, this is one way to do it. You trash everybody else's economy, right? And then you get there. So that is an interest. I think you're right about the drug companies, and the reason why they like the vaccine business, particularly in the United States, is because there's immunity here. And they will get that in other places too. They'll turn this crisis into an excuse for demanding immunity. The vaccine is for the greater good. Everybody needs it. So we're going to inevitably have some people who get hurt. This is what you're going to hear them say. We're going to have some people who get hurt, but that's just, we have to get it out fast. And if we wait until we have something perfect, then the window will have passed, and the world's population will be on its way to extinction. So all the countries are going to grant them immunity, which means that, and once that's done, then they can force as much vaccine as they want on the entire world's population, and they have no liability whatsoever. And that's really frightening, because we have never had an industry that globally was subject to zero regulation for the safety of its products. And that's coming soon as well. So we have to win this one, people. We have to win this one. And the only way to win it, as I said, is to keep our message very simple. This is what I want. You're a yes or you're a no. That's it. This is what I want. You're a yes or a no. And if we vary from that, if we complicate it, I've already had a lot of emails from people asking me, well, we should talk about this issue and that issue. That is the path to being where we always are. A wash at the end of the day, nothing changes. Go back and look at it. What's happened in 25 years of trying to change this vaccine situation? It gets worse every year, not better. So maybe we should try it a different way. That's what I'm going to try to do. I am trying to do.
Limited immunity businesses are not that rare. I mean, the entire telecommunications industry is a good example of that.
Well, it is, but you don't have to watch TV. You know what I mean? You don't have to have a cell phone. This is a situation where they literally are, well, I mean, yes and no, but the physical harm to me is not as acute as it is with the vaccine issue. And once they do this, there's another whole very dark aspect of this, and it's the tattooing that allows people to be tracked. You will lose all of your privacy. Everybody will know every place you go and every person you're with, and they will be able to use that information just like the Nazis used the information. How long do you think it's going to take before they just start getting rid of people who disagree with them? They're keeping them off the airwaves now. They're doing a pretty good job of that, right? How long do you think it is before some of these people are just going to start disappearing because they're inconvenient? How are they going to know where to find them? You won't be able to hide because you're going to have the tattoo in your wrist because that's your permission to leave the house. Think about it. And that is far more, I understand what you're saying. And I understand that other industries need to be regulated. And we need a whole revamp of how we let things happen in this country and in other countries. But this particular thing is more onerous than anything else we have going on. And I'm happy once I get this done. You know, I kind of thought I was like winding down a tiny bit. I figured I'd worked on 106, right? But I was just not going to do it at such an intense pace. Now I'm all fired up again. We get this done in another few months, and maybe we'll take on another issue like telecommunications or something else that we need to do. But we have to win this one because the consequences are just horrific if we don't. Really horrific.
We have a question here from in the chat room about I don't want my kids vaccinated and I want a way out. And one of the things that about vaccines is that there's two different aspects of the vaccine. One is what's the acute reaction, and then there's a lingering reaction where you're altering the immune response of the person in the future. And they're now seeing that flu vaccines have made COVID mortality, have altered COVID mortality.
Mm-hmm.
And so one of the things that I've been tracking for years is the issue of sudden infant death syndrome and other kinds of cytokine crises with COVID infections. And
Mm-hmm.
those are a matter of severe oxidative stress and the inability of the immune system to handle the degree of oxidative stress. Well,
Mm-hmm.
if you take vitamin C, a big dose of vitamin C before you get vaccinated, you shut all that down.
Mm-hmm. Mm-hmm.
So when are they going to make vitamin C illegal because it blocks the vaccination antigen response?
Yeah, and don't think that they won't do that. I mean, you know, if anybody thinks that this is just going to end here, we're going to wear masks for the rest of our lives, and that's all the control that we're going to get. You know, they're going to control everything. And again, go look at what the Nazis did. And it wasn't all about Jews either after a while. It's about Jews and gypsies and anybody else they didn't like. And the other thing that's kind of creepy that's going on, we have a lot of sheriffs and that sort of thing that are publicly saying, I'm not going to enforce this. But we have law enforcement that is enforcing it. And look at what happened in Paris. They were very good at getting the Paris police force on board, and the Paris police force actually helped them find Jews. Yep, we got Jewish people up on the 4th floor there. Don't miss them. I used to be their friend, but right now I'm turning them in because I'm one of them too. Sing louder, my friends. Just keep singing louder, and you won't have to worry about all this stuff. But just unbelievable. Yeah, so you're right. They'll take away the vitamin C. They'll take away we will do what we're told. We're doing it now. We are doing it now. We're not allowed to go to church. We're not allowed to go to synagogue. We're not allowed to have a wedding. We're not allowed to have a funeral. We're not allowed to send our children to a normal school. We don't have any arts. We're not allowed to go to the movie theater. We have to wear a mask at the amusement park. You have to get your temperature taken when you get your hair cut. And it goes on and on and on. You're not living in a free country now, and this is just the beginning. They did this in 4 months. Can you imagine what they're going to do to us in another 4 months or another 4 years? Think about it. You'll be happy you have food by the time they're finished with you if we don't stop it.
Have you seen any kind of uptick from your perspective in grassroots resistance to this process?
Yeah, I have. And this kind of is what motivated us to do this, is that the typical, I had a couple of things happen. I think one of the things is some people who have said, I did what you said, okay? I had a friend who worked at the medical center, and the newspaper said the place was overflowing and patients are in the parking lot. And I actually called her and she said, between you and me, there's nobody here. And I think you might be right. There's something going on. So that's happening. People who are coming around, and this may be where they overplayed their hand, in that the crazier it gets, and the longer it goes on, the more people say, what? You know, some thinking people who are capable of thinking. So I've seen that. But the other thing that I've seen and read in my emails, and I get unbelievable. I mean, while we've been doing this, we've had another 500-600 come in because I can watch on my computer screen here. So I'm getting these emails from people who are, I know it's crazy. And if I'd done this at the office by now, they probably would have come in and thrown the computer through the window because they're not very happy with me today. But anyway, the people saying, I live in Milwaukee and it's terrible here, but I don't know what to do. I'm living in some small town, and if I had some group to join up with, I'd show up someplace, I'd do something. So, and then people are trying to do things, but it's like I said, if I write a letter to Whole Foods and say I'm not coming in, who cares? But if 20 million people do it, Whole Foods does care about 20 million people. And so so I think if we get all these people together, have a gathering place. And as I said, we don't want to interfere with the groups that are going on out there. I'm not trying to take over groups. I'm saying, make your group part of this big group. Let's make all the groups part of this big group, and then let's really do some damage to these people. And we can make it not fun. And here's where this can get, now I don't cry, I kind of get a little twinkle in my eye. Think about the things that we can do to make mischief, all right? So we could have tens of thousands of people file a workers' comp claim because they can't breathe at work. Attorneys will take workers' comp claims for free. And it doesn't matter if you're going to win or not. What matters is you flood the system with complaints until people call the governor of the state and say, we're going to have to build another building and get 19,000 lawyers because of the lawsuits coming in, all right? This is how you put pressure on the system. You overwhelm them. They put this app on our phone without our permission. So think what would happen if we had a call your cell phone provider day. We got 70 million people in our group, and we're all on one day gonna call. They'll call the federal government and say, give us permission to take this off, all right? Because you can crash their phone systems doing this, all right? So this is the kind of thing we have to do. And so this is the hopeful thing. Yes, there are people out there who think like this and they're sick of it. And yes, we are not powerless people. We're not powerless. Me sitting by myself in my house, I'm pretty comfortable, but I'm powerless by myself. Me with 70 million people, we are all really powerful, and we can take our country back. That's what we have to start thinking about, the positive aspect of taking our country back and getting rid of these despots and criminals, including some of them that we thought were on our side in the beginning. I had some rather kind things to say about the nitwit emperor of Ohio, but he's got to go. He's just a nitwit and he's got to go. So anyway, the phone app that I just mentioned, I saw that come in. It's a COVID tracking thing. And if you have an Android phone like I do, you go to Google settings and you can see it right there. It's a COVID notification. That you have to enable it, but at some point in time, they can enable it. They will. They put it on your phone without your permission. Do you think that they put it there thinking, we'll never enable it? They put it there because one of these days they're going to enable it. You're going to wake up and you're going to be traced every place you go with your phone. Good times in Nazi Germany right here in America.
Isn't the NSA already doing that?
I know they are, but I read Edward Snowden's book, by the way. And it'll scare the crap out if you haven't read it. It's kind of he was trying to tell everybody that this was going to happen, right? And I probably was one of the lazy ones back then that thought I'm busy doing other things. I shouldn't have thought that.
We don't ever forgive prophetics.
Yeah. Your iPhone, I don't know where to find it on an iPhone, but everybody in my office has an iPhone and it's on there. All cell phones, all iPhones, all Androids have it on there. It's under health, somebody said on iPhone. Mm-hmm. And you can't take it off. You are not allowed to take it off. You can't. So you think your phone is yours right now? Think again. It belongs to the Nazis. It belongs to the Nazi criminals that are running our lives right now. You can downgrade your IOs. What's your IO? If you could type that in for me. You can downgrade your iOS or Android system and take it off. So if somebody could tell me what that is. Operating system. Okay, so we should look into that. Get it off. On the iPhone 13.5 iOS upgrade out of the contact tracing ability. Yeah, so it's on there.
Yeah, well, Apple just went from a 32-bit mixed operating system to a 64-bit system. And once you click on that upgrade, you can't go back.
Right. So anyway, we have to take them out. They'll find some other way. They'll tattoo your arm. This is just an interim thing. till they can tattoo your arm. They're doing it in Bangladesh, just so you know. It's already being done. Bill Gates paid for the technology a long time ago. And you know who he paid it to? The Centers for Disease Control got some of the money. I think MIT got some, several universities and research centers got some. It's been in development for a long, long time. Preparation to tattoo humans so we can ask for permission from our lords about where we're allowed to go.
Yeah, somebody says, don't do the automatic updates. Yeah, I've been doing that for like 8 years.
Yeah. Yeah.
Uh-huh.
And isn't that ridiculous, right?
Well, most people just leave their system on auto update. And
Yeah.
then when something crashes, they call up and they go, well, your software doesn't work on this new upgrade. You have to upgrade your software over here, 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 here. And so it's just this never-ending system of becoming more and more dependent.
Yeah, well, I think the key is we have to get rid of the problem. In other words, if we think that we're going to avoid the tyranny by downgrading a phone or turning off an upgrade, we're out of our minds, because they'll find some other way. Like I said, look what they've done in 4 months. I'm astounded. I am astounded, and I think they have been pleasantly surprised at how easy it was to get everybody to comply. Since they're rubbing their hands together and thinking how easily this was, can you imagine what's going to happen next? Yeah, we are going to be put in camps. We're going to be wearing armbands. They're not, and this is what's really scary. Hitler really just hated some people. Okay, he was just a despot, but he targeted groups of people who he hated. These people hate all people. Okay, they're just as happy to take a Jew or a black person or a Muslim person or just an everyday average white person. You can't tell where they came from. They don't care. They will just get anybody out of the way who's in their way. All right. So, and no, I'm not saying Trump is part of this conspiracy. Just for the record, I think he doesn't know how to get out of it, but I don't think he's part of it. I think Biden is, because you know what Biden says? If he were president, everybody'd wear a mask, and he would put Fauci back on TV every day. So if you're in love with Mr. Fauci, make sure you vote for Biden, because you'll get a good dose of Fauci every single day as soon as he's in office. And remember how great that was? We got lied to every day at 6 o'clock. And then we got to listen to Deborah Birx explain how doctors should forge death certificates. She actually said this. No matter what they die of, we code it as COVID. And you can watch it online. It's on YouTube. They don't even take this stuff down. That's how full of themselves they are. So if we really, 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 I know that you venture into this political arena and people get all sideways, but you can go watch. Biden actually said he loves Dr. Fauci. People have suggested that Dr. Fauci could be his vice presidential candidate, except that he promised a woman. So that probably won't happen, which means he'll continue to be America's doctor and set the policies for everybody. I'm so excited, right? Because it's been so great up until now.
There was a Democratic campaign when Trump was talking about bleach, as a COVID thing. They said, vote for Biden. He won't inject you with bleach. And I wrote this thing below it and said, he'll inject you with aluminum.
Yeah. 6-7 times a year, at least.
Well,
yeah. So
at least if you're a child.
Oh, no, you think that these vaccines, you think adults aren't going to have to get vaccinated? No. The plan's for everybody.
Yeah.
Everybody.
6 or 7 is more like 20 or 30 if you're a kid.
Yeah. Oh, yeah. So, well, this will not go away on its own, people. We have to really mobilize. But why being negative about Biden? I'm not being negative or positive about anybody. I'm reporting what he said. Okay. So that's what he said. Now, I happen to not want to wear a mask, and I really, really, really am about up to here with Mr. Fauci. Okay. Because he lies when the truth fits better. So I don't care who thinks Fauci's great. That person is on my list, okay, because he's a moron. He's a criminal. He's a career criminal. All right. So if you're for Fauci, I'm against you, and I don't care what party you happen to belong to. So anyway, yeah, your job at the airline will require a COVID vaccine. There's an article in the New England Journal of Medicine, current issue, I haven't had a chance to read it yet, that says that employers should fire or lay off people who refuse to get the vaccine. Yeah, so if you think the airlines and the hospitals are the only ones, You're going to have to go to work for a small company because all the major ones are going to be pressured into making you get jabbed at the door in order to keep your job.
Well,
That's
if you
coming.
aren't allowed to file taxes until you are in compliance with something and you get convicted of tax evasion,
fraud.
don't file taxes, then they can make all the small businesses do it as well.
Right, exactly, exactly. They'll get us all unless we get them first. That's really what it comes down to. So I hope we get them first, people. Let's get them first, okay? All right, well, I'm gonna have to go on to the next thing, but thank you for having me. I appreciate it.
Thank you for being here and being blunt.
Well, I always tell the truth. Sometimes people like it, sometimes people don't, but that's what it is. MakeAmericans.freeagain.com. Go there, join our movement. Let's get these people out of the way once and for all. Take our country back. Thanks. You guys have a great rest of your day. All righty.
Appreciate it.
Bye.
Save the chat for all you people out there who want all the links and comments and stuff like that. Just click on those 3 dots to the right of the chat entry window and then click on Save Chat and it'll save on your computer. I don't know how to do it on a cell phone.